بسم الله الرحمن الرحيم. Type and design of dental bridges. Fixed prosthodontic is a branch of prosthodontics concerned with replacement and or restoration of a teeth by artificial substitute that are not removed from the mouth. We said replacement for the missing teeth or restoration. Sometimes the retainers may be in layers on layers that considered as restoration. Advantages of replacing missing teeth: to restore function for both ability to eat and ability to speak, they consider as function. Restore aesthetics, restore health to as preservation of periodontal health, prevented drifting, tilting, occlusion maintenance, stability, restore occlusive vertical dimension. Also from the advantage is feeling of completeness, and also orthodontic retention. Mostly used is adhesive type bridge used as orthodontics retainers. We are going to remember already. We are going through in the past the 4 years. The first one is abutment. Abutment is the prepared tooth. Here in this bridge is a fixed 3-unit bridge. Preparation in 6 and 4, replacing 5. The 6 and 5 is considered as abutment. Retainer is that complete covered crown in 5 and in 6 in the 6. Pontic is a tooth artificial tooth that replace the missing piece. Connectors, two design of connector, either rigid or non-rigid, that connect between the retainers and pontics, or between 2 pontics, or between 2 retainers. These all are considered as connectors, can be movable or non-movable. The span is the edentulous area. Unit is either retainers or pontic. In this they are 3-unit bridge. Pier abutment is the abutment that stands between 2 edentulous area. Types of bridges: conventional bridge, minimum preparation bridge, hybrid bridge, and implant supported bridge. Design of dental bridge: either fixed movable, simple cantilever, and spring cantilever. As a summary for type and designs, we have conventional bridge at either fixed or fixed movable, simple cantilever or spring cantilever. Simple cantilever from one unit, from one side, only one abutment, or maybe double cantilever, 2 abutment are used. Minimum preparation bridge, either fixed or simple cantilever. Simple cantilever is superior to fixed in minimum preparation bridge. Hybrid bridge, that means combination between adhesive and conventional. Mostly it is fixed movable. Usually in hybrid bridge design, we use a movable joint. As the 2 retainers, there is a great difference in the retention of the retainers, so we are going to use movable joint. Implant supported bridges, either fixed movable, or simple cantilever. We are going to discuss each one, the advantage and disadvantages. Fixed bridge, retainers and pontic connected by rigid connectors. It is minimum 3 units. The preparation of the abutment must be parallel. Advantages: best retention, splinting of abutment, applicable for large bridges, conventional lab work. Disadvantages of fixed bridges: more tooth reduction, especially to obtaining parallelism. Difficult to prepare when several teeth are involved. Cementation is more difficult because cemented in one piece. All these are disadvantages of fixed bridge. Fixed movable bridges, there is a rigid and non-rigid connectors. Fixed movable bridges used when it is difficult to obtain parallel preparations. Major retainers, rigid, full crowns in the distal one. Minor retainer, non-rigid connector related to it, may be used as partial crown, mostly in the mesial part. Advantages: more conservative, no parallelism. Minor retainers can be used, which is minimum preparation. Minor retainers usually no need for full coverage. Allow minor movement of the teeth. Parts cemented separately. easy cementation. Disadvantages: limited span lengths, difficult lab work, temporary bridge difficult to make, movable parts tend to wear out under constant usage. Usually there is a friction, so it may be where is possible. Cantilever bridges: a bridge providing support or retainer from pontic at one end only. May be simple, only one abutment, or maybe one retainers, or maybe double cantilever bridges, 2 abutments are prepared and 2 retainers connected by rigid connectors. This is an example of simple cantilever. Here also simple cantilever, adhesive design, replacing upper lateral, abutment is the central. Cantilever bridge support for pontic at one side. Retainer can be one or more splinted teeth, mesial or distal. Advantages: conservative, one retainers, easy preparation, adjacent abutment easier to be parallel, easy lab work. Disadvantages: limited span length, need very good abutment, produce torque force on the abutment, and lead to vertical bone loss in the abutment. Spring cantilever bridge, a bridge that replacing one maxillary incisor that connected to a long metal arm and passing over palate to join on one or 2 splinted posterior teeth. Spring cantilever bridge, only to one maxillary anterior tooth. Force applied to the pontic absorbed by springiness of the spring transmitted to the underlying soft tissue. This photo is a spring cantilever bridge. Here this is replacing this central, the arm transmitted across the palate, and the abutment is upper 6. Usually the 6 is indicated for coverage due to root canal treatment or need for full coverage. You are going to do spring cantilever. Now it is not done today. Now it is history of dentistry. Advantages: the sound adjacent teeth do not need to be prepared. Can be used in diastema cases. More conservative. Metal crown can be used on the posterior teeth. Disadvantages: palatal bar intolerance, difficult to clean under bar, trauma of the pontic to the gingival papilla, need very good prepared abutment with good retention. Adhesive bridges has many names: resin bonded bridges, minimum preparation bridges. The pontic attached via a metal plate to minimum prepared lingual surface of the adjacent teeth by adhesive system. In this photo, the adhesive bridges, lingual flange extended the palatal surface of the adjacent tooth. Advantages of the minimum preparation bridges: most conservative, it is intra-enamel preparation, less time for preparation, less tissue irritation, anesthesia not need, no temporary crown is needed or bridges. Disadvantages: need very skillful lab work, cementation is technique sensitive, usually using resin cements, possibility of debonding, anesthetic graying of incisor surface in the thin labiolingual tooth. If I have a thin tooth labiolingual at the incisor edges, if you use a metal Bersolin fused metal design, metal may be showing. If you use, in these cases, you can go for all ceramic adhesive bridge. Hybrid bridges, it is combination of minimum preparation and conventional retainers. In this case, minimum preparation, usually there is a movable joint in hybrid design, as here is the adhesive flange and here is a full coverage porcelain fused metal. Here is a non-rigid connectors or movable joints. Implant supported bridges and endoosteal within the bone, alloplastic biologically compatible material, surgically inserted into the edentulous bony ridge. Uses to serve as a foundation for prosthodontic restoration, and fixed bridges is an example. Advantages: no preparation of the tooth adjacent teeth, bone stabilization and maintenance, retrievability, improvement of function, psychological improvement. Disadvantages: risk of screw loosening, risk of fixture failure, length of treatment time, need for multiple surgeries, challenging aesthetics. That is all about type and design of fixed prosthodontics. Thank you.